Professor Dennis Kenji-Kimper is a research director at the Cyber Intelligence Institute. He joins us from Frankfurt in Germany. Good to have you back on the program with us, Dennis. Now, why are we seeing so many more people turning to AI chatbots for things like healthcare?
Yeah, there are really two forces at work. So the first one is access, or rather the lack of it. So in the UK, waiting times for doctors are very long, appointments can be hard to get, and people are looking for answers very quickly. And AI is available instantly at any hour at no cost. And that's genuinely powerful proposition when you're worried about a symptom, for example, at 11 o'clock at night. And the second force, in my opinion, is familiarity. So we've all grown used to asking our phones for information, and turning to an AI chatbot for health questions feels like it's some kind of natural extension of that habit. And the challenge that we see is that health information is categorically different from searching for a restaurant. So the stakes are higher and the margin for error is much smaller. And people don't always appreciate that distinction, and that's where things can definitely go wrong.
Now, given that AI isn't actually trained for these tasks, recent studies suggest that AI chatbots can give misleading or incomplete medical advice up to half the time. So who should actually be held liable when a chatbot gets a diagnosis wrong?
Yeah, I guess that's one of the most unresolved questions in the entire AI space, and regulators are genuinely scrambling to catch up. So right now, the liability landscape is deeply unclear. So AI companies typically disclaim responsibility in the terms of service. So they, for example, describe the products as informational tools, not medical devices. And healthcare providers who deploy AI carry some duty of care. And patients in many jurisdictions are told they use these tools at their own risk, and that's not some kind of sustainable position. So if 1 in 7 people are making health decisions based on AI output, we can't have a system where nobody is accountable when something goes wrong. I think we'll see regulatory frameworks emerge. So, for example, the European AI Act is already moving in this direction, that require health-facing AI to meet defined safety standards and that assign liability more clearly.
Now, OpenAI launched ChatGPT Health earlier in the year to help analyze medical records, and Anthropic offers similar features on its cloud platform. Does this raise concerns over our privacy and data?
So I see that we have already some changes here. So we see changes that are happening to some degree. There are models being developed specifically for clinical and consumer health context, trained on medical literature, clinical guidelines, and patient interaction data. And of course, they have also some data security and data privacy provisions, which are stronger than other models. So I would say the ambition that we see here is real. And in some narrow tasks, for example, reading a scan, flagging drug interactions, summarizing a patient record, the accuracy is already impressive, and these models are much better than general language models. But accurate, I would say, in healthcare means something very specific. So it means getting it right, and not just most of the time, but consistently across very diverse populations in edge cases and also in high stakes scenarios. So no AI system currently is there yet across this board. So the models being developed by companies like OpenAI or Anthropic, they're definitely powerful and they're good in some way, but they still need clinical validation, regulatory approval, and critically integration within a clinical workflow rather than operating in isolation. And this is what we currently see.
Dennis, always great to have your analysis. Professor Dennis Kenji-Kimper in Frankfurt. Thank you very much.
Thank you.